Good morning friends. I am Dr. Roshan Jaiswal, pediatric orthopedic surgeon working at Kamineni Hospitals. Today we would discuss about one of the most common problem faced by a newborn child. It is called clubfoot in regional terms. Scientifically it is known as congenital talipoequinovarus. Clubfoot, as the name goes, it's a very simple disorder wherein the foot is shaped like a club. Club is the bat used by golfers while playing golf. So what happens in this? Primarily the child is born with a foot which is shaped like a club. It is crooked, both bending inwards. This can even be diagnosed prenatally, that is before the birth of the child. With the advance in ultrasound technology, we can diagnose this very easily in the prenatal ultrasounds. Many parents become apprehensive when they come to know that their child is having a clubfoot. But there is nothing to worry. When there is a solution for the problem never stays as a problem. So there is a very good solution for all clubfoots. So parents who are about to conceive, they get a report by the ultrasonologist that there is a clubfoot for the child. They become very apprehensive, go searching around in the Google, and they even think of termination of pregnancy, which is a very bad idea, because this is not a problem which is going to cause him a life-threatening problem, nor it is going to cause him a long-term physical disability, because there is a very good solution for this in all kids, all the newborns. The only thing is we should be aware about what treatment can be done, and the treatment is very simple. All these kids have to be examined by a pediatric orthopedic surgeon as soon as they are born and looked for other associated deformities if present. Mostly they don't have, but if they have, it has to be addressed. All this clubfoot undergo a simple plastering technique called as Ponseti casting. This involves application of plaster to the given child's leg in a successive manner every week, changed at weekly intervals. There are certain group of deformities in this clubfoot. So each deformity is corrected in each plaster setting. The plaster extends from the toes to the hip, and at weekly intervals it is changed. When we change at weekly intervals, one by one all the deformities get corrected. Once all the deformities is corrected, the child undergoes a very small procedure called as tenotomy. Tenotomy is just lengthening of a muscle with the help of a needle or a syringe needle, which doesn't require any sutures. Once this tenotomy is done, again a plaster is applied up to the hip joints under the anesthesia. Once the foot is fully corrected, the child needs to wear certain types of specialized shoes called as DB splint or Dennis Brown splint. These are very specialized shoes. The most common mistake what all the parents do is, once the foot is corrected, they become compliant and they don't use the shoes. But these shoes are also called as retention shoes, and as word goes, retention means maintaining back the position which is gained. If you use this retention shoes for a period of 1 to 2 years, the foot will be as normal as any other foot of any other child. There are certain taboos associated or certain wrong thinking which is associated with clubfoot. Many, especially the grandparents, think that application of plaster can make the foot more weaker, or it can make the child's life more difficult in that neonatal period. But it is very important and empirical to start treatment as soon as the child is born. Many parents think, why to trouble the child? अभी इस बच्चे को क्यों तकलीफ देना है? हम 1-2 महीने के बाद प्लास्टर शुरू करेंगे. That is a wrong way of doing things. We have to start the treatment as soon as the child is born. Initially, as soon as the child is born, there is manipulation, and at 7 days of life, we start doing this Ponseti technique.